morning, good evening, wherever you are. I'm Charlotte Kahn, delighted to welcome you to the Voices of Sustainability virtual fireside chat series. Now, the Zayed Sustainability Prize was established in 2008 as a pioneering global award for recognizing organizations and high schools for their sustainable, innovative, and humanitarian solutions. Today, the prize counts 16 years of global impact, with over 384 million people around the world benefiting from its winner solutions across the categories of health, food, energy, water, climate action, and global high schools. In today's episode, our guests will emphasize the importance of addressing the healthcare needs of vulnerable populations in particular. So please welcome our wonderful guest. We've got Dr. Laura Stachel, who's co-founder and CEO at We Care Solar, Frank Beadle de Palomo, who's CEO of Mothers to Mothers, and Harish Hande, who's co-founder at Selco Foundation. Welcome to all of you.
Thank you.
Thank you.
Thank you.
So to start with, can I please ask you all to briefly introduce yourselves and the company or foundation you work for, please? Starting with Laura, please.
Yeah, thanks so much for having us here. I am the executive director of We Care Solar. We are a nonprofit that was started in Berkeley, California, but actually has an international footprint. We work on bringing solar electricity to health facilities in rural areas. And we have an initiative called Light Every Birth, which is bringing solar electricity in specific to maternal health care. We believe every woman has the right to deliver safely in a well-lit health center. And so we are doing national initiatives, bringing thousands of solar electric kits to health facilities in order for mothers and babies to deliver more safely.
Frank, I'm sure that resonates with you.
Resonates very, very much. My name is Frank Beadle de Palomo, and I'm president and CEO of Mothers to Mothers. Mothers to Mothers is an African NGO that was originally born to end pediatric AIDS through a highly effective peer mentor model. And we now provide services and healthcare to families who need it most, delivered by women who know them best. And our focus is on building a healthy, thriving Africa.
Thank you very much. Harish, now tell us all about the Selco Foundation and your wonderful work.
Thanks so much. So I belong to this organization called Selco Foundation, who uses we use sustainable energy as a catalyst to democratize the delivery of health, livelihoods, and education. So how do we for us, solar is just on top of a roof, but the primary way is to innovate from a systems thinking process of efficiency of appliances, transaction cost of people receiving those services, redesigning maternal labor rooms or hospitals or livelihood applications to make sure that that development is a way to sustainability and not vice versa. Yeah.
Thank you very much. So next, I'd like to hear maybe in greater detail how you effectively implement your healthcare services or solutions on the ground to reach vulnerable populations. Laura, can you tell us more about what you do?
So primarily our work right now is in Africa, where we know there's more than 100,000 health facilities that lack reliable electricity. And what this means for maternal health care is that midwives and doctors may not have light to be able to diagnose, to be able to understand what complications their patients may have, and to be able to provide effective life-saving care. So we're going country by country with prioritization to countries that have high rates of maternal mortality and low rates of electrification. And we work in partnership with governments, UN agencies, and international NGOs to try and create systems change so that every public health facility can have the power to save lives. We designed something called a solar suitcase, which has medical surgical lighting, it has medical devices, it has power for other charging, such as for cell phones or other devices. And we've created a system of training people in their own countries to become solar installers and ambassadors, bringing these kits to thousands of health facilities throughout multiple countries. So far in Africa, we've reached more than 9,000 health facilities, which are serving more than 16 million mothers and newborns. So our idea is to try and improve the capacity of health workers by strengthening the infrastructure so that they can be able to do the jobs that they were trained to do.
And Laura, just to give a little bit more context, there is a certain compounded injustice when it comes to access to energy, isn't there? Because there's obviously, well, coverage, the fact that Africa in particular, and from what I remember, just half the population is connected to the grid. There's a problem of affordability as well. And the fact that you mentioned that not having access to it can also make access to safe healthcare so much more complicated.
Yeah, and I think even for those facilities that might be connected to the grid, being connected in this day and age doesn't mean continuous electricity. There are power outages in some countries that are using hydroelectricity. Climate change has contributed to droughts. There's not enough power. So even those that are connected may have sporadic electricity. And obviously childbirth happens 24 hours a day, and you can't predict when someone's going to need services. I've been in operating theaters doing cesarean sections when the lights have gone out, and it is frightening for everybody involved. And you would think that there might be systems in place to ensure that the most critical services can occur around the clock, but actually hospitals and health centers are subject to the same load shedding that all the other communities are subject to, so they actually don't have control. In turn, health workers are using things like candles and kerosene lanterns. Sometimes they'll use diesel fuel generators, which are then dependent on fuel that may be subject to breakdown. And those systems don't provide adequate continuous surgical grade lighting. So it really does compromise care. And it also not only inhibits the ability of health workers to do a good job, but many patients are not really interested in traveling long distances to get to health centers that don't have light. And so it actually affects the whole system. It affects demand for services as well as the effective supply of services. And it really cripples the ability to provide life-saving care.
Thank you very much. Frank, can you also tell us about the big problem you're trying to solve and how you go about it on the ground?
Sure. Well, thank you. When we started, our initial big problem that we were trying to solve for was HIV transmission from mother to child. And when we started in 2001, a large number of children were being born HIV positive to HIV positive women. And so we were talking about millions of children across the continent. And there were medications, antiretrovirals, there was understanding, there were test kits. There just wasn't time, and there wasn't a link to clients. And so what Mothers to Mothers did that was for us very, very different 23 years ago is we decided that instead of thinking that populations were hard to reach or that populations needed to be treated a certain way, we brought the population, we brought the community into the health centers. We made sure that we didn't think of them as hard to reach. We just made sure that we reached them and brought them in because we were community focused. So from the very beginning, we've deployed a peer-led model to reach our clients. For us, it's about being peer-led, people-centered, powered by women. And we provide a comprehensive set of services, including clinical care delivered by community health workers and other health professionals, such as nurses. Our model is called the Mentor Mother model, and it's built on a foundation that we like to refer to as the power of one. It's about one human being connecting with another over a shared experience. And for Mothers to Mothers, that shared experience is unleashed via a woman living with HIV connecting with another woman who is either living with HIV or is at risk for acquiring the disease. We make these connections in health facilities, door to door, in African communities, in refugee centers, and also now in telehealth technologies. And our mentor mothers intimately understand, they know the fears, they know the stigma, they know what it's like to be diagnosed with HIV and to be told that their life was either over or there wasn't much opportunity for them because they've experienced it. And we help them, we train them, we professionalize them, we employ them to be able to share this knowledge and compassion with other women through our health education programs and services. And for us, it goes beyond just that shock of diagnosis. It also means that we are thinking about the population where they're at. So Women of a certain age are providing services to other women that of reproductive health age. We have younger peer mentors who are providing services to adolescent young girls, young women, young boys, young men, and we even have males that are providing these services to other males. And our frontline community health workers also work with entire families. We now have programs that encompass early childhood development, orphans and vulnerable children. I already mentioned the adolescent program. And through our approach, through our time, we've employed more than 12,000 African women living with HIV. We've reached more than 16 million people with life-changing health services. And we know that we have kept nearly 3 million at-risk women and children alive. And so for us, it's that vulnerable, that community is all about bringing that community and those vulnerabilities into the system and then addressing them.
Well, that's remarkable work. Thank you very much. Harish, tell us about how you implement your solutions on the ground. And there again, the big problem or the big challenge you are facing and attempting to address.
Thanks. Yes. I mean, for us is while we look at the 3 or 4 areas in the health sector, one is the accessibility itself to the poor, because sometimes you might have free health services, but it's not free for the poor to access it. And so what is the cost on the poor, right? Number one. Number two, the modernization of equipments that are happening, but those innovations are really catered to resource poor areas in terms of the hard to reach places. Number three, yes, energy is part of it, but we believe that energy is a catalyst to enable. Number four is the type of structures itself, like the structure of the maternal labor rooms are like dark, dingy execution type chambers, right? How do you make them architecturally aspirational? So our whole process is, while these are all negatives, what are the solutions that you can actually provide that if you visit in 2035, you will still feel that's relevant today in 2035? How do you make it modern? How do we not just go and put band-aids to present solutions, but how do you make them ready that they are 2035 ready today, so that people are getting the most modern facilities of like a foldable dental chair or a suction pump or a baby warmer? Why should and use decentralized energy as a catalyst? So we look at innovations in the building design, the innovations in services itself. For example, if there are 100 services that need to be given in a public health center, we're saying that in 2030, would these 100 services actually need a physical center, or teleservices would have taken over? So we would actually put teleservices in rural areas with solar power, where people would come and sit, and they can actually find which doctor is available in which city and then click, and the doctor can actually do the blood test, blood pressure, everything else, and say that you don't need to go to the hospital, etc. Right? How do you lower the transit? And all this is powered by solar. How do you relook at when people say human resources are a constraint to reach rural areas? How can I use technology to relook at not human resource? So put all those pieces of the puzzle together and saying that, okay, if I have now created in rural India at this resource, it can be easily replicated in Harlem or rural parts of, or the poorer parts of London, right? How do you use the lack and the barriers in India or Indonesia and Africa as a positive way to innovate dental chairs, baby warmers, suction pumps, delivery tables, autoclaves, so that it also becomes affordable for the poor in the US and Europe, for example, right? So how do you use solar energy to democratize that? And that's where we have now embarked on one of the largest programs, solar powering 25,000 health centers, along with IKEA Foundation, and basically in the Northeast, and where the terrain of like a particular state of Mizoram, which could then be replicated in like the transaction cost of maintaining that or creating that or remoteness of it using teleservices as well as maternal labor rooms, can it be then replicated in Tanzania or rural Argentina, right? So how do you create those replicable models? And that's what we're doing by using this 25,000 as a quote unquote pilot of innovations from technology, efficiency, building, transaction cost, maintenance together as a piece here.
Harish, what you have just shared with us is the perfect illustration of what the prize is attempting to reward: those innovative, sustainable and scalable solutions to address this issue of access, of course, to energy and affordable energy in particular. Harish, do you see progress towards universal access to healthcare, and how, I mean, you've already given us a few hints, but how do you think that you are contributing to this?
See, one side is the demand, right? The demand side where we know that there's a huge demand from Sierra Leone, which is one of the highest maternal deaths, to rural parts of India where you can actually do a malaria test, etc. The challenge, when you design solar for autoclave or a baby warmer, the blame goes on solar to be expensive, but not, oh, the baby warmer actually is inefficient or the autoclave is inefficient. And that's exactly why you need more solar. Now, there has to be pressure on medical companies to create and innovate devices that are for resource poor areas, right? It's not like I need a dental chair with 350 features. That means it guzzles more electricity. Can I have the basic of 20 features, which is foldable, that I can provide dental services to the people right at their doorstep in the remote islands or anywhere else? I think the challenges now are not on the side where you can actually create the demand for provide services for the demand with the technology and teleservices and everything coming up. What is the responsibility of the big companies to come up with equipments that need not be in just large hospitals? So that's the pressure that we are trying to put with our scale program, is how do large companies like Philips, the GE, turn over and say that we need to have a complete different division, because once you create innovations in technology and services, it could then be replicated for we are saying that this is the reverse innovation that goes from the underdeveloped areas of the world to the developed part of the world, right? So that healthcare also becomes cheap for rural Massachusetts or in California or Mexico. How do we make that happen? And that's what we're trying to push for.
And I just like to comment on that. I really think that the approach that Harish is talking about is brilliant and absolutely necessary. And I'll give an example of some of this kind of reverse innovation that can then work in other parts of the world. When I started our organization, I was working in Nigeria. An ultrasound machine, a machine to get an image,
Right.
let's say, of a woman during pregnancy, was a large device standing alone on the floor. It had 400-watt requirements for energy. So it was, and they couldn't use it. Literally, I had a patient come in with an emergency. There was no power in the hospital. I had to pay $25 for someone to get the fuel, to put in the generator, turn it on for 5 minutes so we could get an ultrasound image. We have now developed ultrasounds that you can hold in your hand. They're the size of a tablet, or you can attach them to a smartphone. So you now no longer have those huge energy requirements, but you also now have a device that can go anywhere. You don't need a big machine. And you can use it in, American physician could have one in their pocket and to be able to use it where it's needed. We're now training women throughout Africa. How do you actually use these in clinics that, you were talking earlier, Frank, about we don't like to talk about the last mile. Well, let's call it the first mile. How do we bring these technologies to the first mile? Well, you need to make them affordable and usable and energy efficient. So I think that the approach that Harish is talking is just so important to talk about. When we talk about universal healthcare access, it is a multifaceted issue. You need to have patients that understand, or communities that understand the need for healthcare. You need to have access, whether it means having the center there or literally having transportation or creating telemedicine, the way Harish is describing. And then you need to look at the facilities themselves and say, what are they offering? Do they have the appropriate infrastructure? Are they designed appropriately? Do they have the number of people they need? Are there workforce shortages? Are there people who are there actually trained and supported and mentored so that they don't feel completely isolated? I've gone to remote clinics in Sierra Leone where someone is there facing patients that may have terrible complications, and this woman maybe has a 6th grade education, very few years of experience doing deliveries, yet she's being asked to triage very difficult things. If you could have the type of telemedicine that Harish described and give her access to people that could continue her education or give her backup support, you're going to really improve medical care for those communities. And for these things, you need financial support and you need political will. And you need also stability so that you're not having either climate disruptions, political disruptions that are then adding stressors to already fragile health systems.
You know,
I
I think
think
I just wanted to be serendipitous and to connect these pieces, because I think there's not just threads, there's entire currents and rivers of agreement here in terms of how we look at these issues, because there's so much that can be done by reducing costs, bringing in great innovation, making sure that we are thinking about resources in a very different way. The West has incredible medical care, incredible technology, but I would actually challenge that access to healthcare is quite limited, especially to good healthcare or quality healthcare. Someone might have an operation, they might get the best technology, but there's no follow-up. Someone goes home and they're in a situation where there's no caring for them in their home, where they can't afford a rehabilitation space. And so one of the things, and again, I'm in total agreement with both what Harish and with Laura are saying, one of the things that we also try to do at Mothers to Mothers is our frontline staff are about changing the approach to the way we think about employees and scarcity of medical staff by task sharing and making sure that, for example, our mentor mothers are now doing work in tuberculosis. They are collecting sputum. They're making sure that they're reaching individuals in places that are not usually found. They're providing direct observed therapy. We in Lesotho, we are doing work around cervical cancer. In Malawi, we are doing work to make sure that HPV vaccines are being provided to the right individuals at the right time so that we're not dealing with cervical cancer down the road. And I think that part of what we're trying to do is not just enabling and equipping a ground-based, community-based workforce, we're also trying to provide technical assistance and advisement to the actual ministries of health, to governments, to help them understand all the pieces that we're talking about, whether it's how the system is designed, how facilities are set up, where they're set up, how they're staffed, and what kinds of services are being available. We've had incredible uptake where I can proudly say that, for example, our mentor mother model has been adopted by several countries. We've actually transitioned our staff to government employees. That's fantastic. But our three organizations, we need 300 of our organizations to continue to push this and to engage this. And that's one of the things about the Zayed Prize that I love. It's about unleashing innovation. It's about unleashing the best of the best for those who need it. And from the point of view of being a Mexican who works in Africa, I come from communities in which need is great, and we need more organizations like the ones that are represented here today.
Absolutely. I was going to follow up by highlighting the fact, going back to the point Laura made, that we've got this emerging tech at our disposal and we can leapfrog as well. And it's got obviously fantastic results. But like you mentioned, Laura, we also need finance, and we need, of course, this political will. And going back to the point you made, Frank, we need this empowerment as well to scale up the solution. Otherwise, it's not going to have the same impact, of course. The next point I wanted to make and maybe ask you, Frank in particular, as a selection committee member, since you mentioned the prize, how do you see the prize contributing to improving healthcare access?
I guess to start with, I think that the way that the prize has become positioned and the prestige it carries, it really is creating kind of a global benchmarking and innovation, which I think across so many different sectors that are so complementary, whether it's health, whether it's energy, whether it's climate, whether it's secondary education, really, really important. I also think that the criteria that the prize uses to motivate entrants, when you think about the kinds of things that we look at when we review these applications, when we review what individuals are putting forward, it's almost about promoting a realistic moonshot mentality, meaning that it's about stretching, pushing, projecting forward, but with things that are either tried, true, tested, or being adapted for that space. And I think that is about, as my colleagues have shared, It's about bringing these technologies and implementing them in ways that people who need them most actually get access, because we all have examples of, as Laura mentioned, these incredible technologies that are sitting in clinics and hospitals, and either there's not electricity, uh, there's not parts to repair them, there are not, the supplies that run these things, and so a technology itself is not going to be innovative. It's the manner in which we apply it and how we try to build a support system for that technology to be used. And I think the prize really is about that.
And of course, it's also creating a community, since you are talking about this need for a more holistic approach involving many stakeholders. Surely that's an important aspect as well.
It's completely. And I think that community of, entrepreneurs, innovators, individuals, practitioners who can reach out and touch and get to know each other, it's really important, because we all need help at different points of our kind of our timelines and our implementation, of colleagues, of peers, of others who can help both encourage us, but also help us with that one spark that will help the innovation really come to life.
And Harish and Laura, since you're both past winners of the prize, can you tell us more about how winning the prize has expanded your efforts? What has it unlocked for you?
See, one thing I keep saying about the Zayed Sustainability Prize is like, it's an unrestricted prize, right? So what happens, the beauty of having an unrestricted prize money is that your ability to take risks and fail is much higher, and which is what is required, because the in normal funding cycles that normally happen across is like, you need to make sure that you're 110% successful, and especially in a very complex situation like poverty and health, no way you can be even 20% successful. And so the prizes, the Zayed Prize monies actually help you create the foundation of innovations that you wouldn't have taken with other types of monies at all. See, today, when people say it's not about the branding that you got the Zayed Prize, for me, the most critical part, yes, that network, I mean, it's the branding and everything is critical, but also that money is the most expensive money that we have got. And what I mean by the most expensive money is that it is what has led to us creating this 25,000 program for 25,000, which wouldn't have happened if we had not laid the foundation of risk and innovations that I could then scale up from a business model innovations, that no questions asked, even if I fail. I am not worried about where am I writing the report to, how do I write it, but I need to focus on what is my success, come on, rather than the monitoring and evaluation, blah, etc., which takes enormous headaches. This was purely which put us focus on, led to writing the larger proposal for this 25,000.
Thank you very
For me, I'd say one of the things that was really most meaningful about the prize is the entire ecosystem that comes with the prize. The people that we've been able to meet, people like Harish and people on his team who I've met every year when I come back for the prize, we can share ideas, people who are working in other sectors. And I think maybe we haven't mentioned this enough, but really the problems that all of us are addressing are multi-sectorial problems. Like maybe we're talking about health, but it's
Right.
health and energy and it's empowerment. And I didn't mention that we train women to be the solar installers. And so we're doing, economic opportunities for women and trying to do poverty alleviation. And most of us, or all of us here, I think are doing that. We talk about separate siloed sectors, but that's not the way problems exist and it's not the way solutions exist. So the fact that when I go to Zayed, I can meet someone next to me who's working on nutrition or someone else who's thinking about education, that's very rich. That really allows for a lot of information sharing, new ideas, new potential partnerships. I've also been able, through going to the prize multiple times, meet with some policymakers themselves and create relationships that can help to nourish new programs that we're thinking about. So I've met ministers of health from different countries and then been able to enact programs there. So I think both the branding of the prize, as Frank was saying, it definitely has a great reputation, but the people that come together, and we come for several days together working in the area of sustainability. And particularly now that the prize has branched out, it used to be just focused on energy. Anybody who's applying to the prize should know that when you describe your solution, you're going to be asked to say, how is your solution addressing multiple areas of sustainability? There really isn't just this one siloed focus, which I think is very, very appropriate. And then I also feel like even applying for the prize, it made us really crystallize some of our ideas and think, you know, what is the impact we're having? What are the things that we want to show? So sometimes actually the process of applying can be very helpful for a team to start crystallizing ideas and think more carefully about the ways that we're both achieving and describing our impact.
Well, Laura, Harish, and Frank, thank you so much. It's been really inspiring to hear your stories, but also how you implement, you know, your solutions on the ground. And in a world where it's easy to be consumed by all the bad news and toxicity in the general discourse, it's great to feel your enthusiasm and the energy with which you try to solve big problems indeed. So a huge thanks to you. It's been an absolute pleasure to talk to you today.
Thank you.
Thank you so much.
Thank you.
Thank you. Thank you.
And before we go, just a few words for you, the audience. Thank you very much for watching indeed. And if you'd like to watch the entire session, it will be posted on the Zayed Sustainability Prizes YouTube channel. Don't miss it and stay tuned for more episodes of Voices of Sustainability.